200. Perfect. Sorry. Yes. But I think there's a real opportunity to continue sharing here. Is we do want to take a few minutes to hear from each of the tables. So I hope at each of the tables you can identify somebody who can succinctly give us a bit of a rundown of the main points that you want to share with the broader group, because it'll help that broader group also. Maybe that didn't come up in their discussion, so it's a nice way to share. So I can randomly pick a table. I will. I'm gonna pick temperature fluctuation, isn't it? Alterations of temperatures. Who at this table would like to? Minister? Perfect, here we are.
She wrote it, so I'm not probably proceed.
Just a couple points, just share with
But you write it, so I can't.
Okay, so the health consequences that we came up with was pertaining to the elderly in terms of high temperatures and also low temperatures, elderly that live at home, especially looked at women probably in their menopause time of their life stages, and then also elderly men. We also looked at dengue fever, which might be exacerbated during that time. We looked at, in terms of the instability of local labor to livelihoods, we looked at agricultural crop damage. We also looked at construction workers who might not be able to go to work because of rainy season and of course, the climate not being conducive for building. We also looked at landslides. We also looked at the fact that some of the diseases that could be caused was like diseases emanating from molds, lung and chest infections taking place. In terms of legislative responses, we thought that in situations of limited resources, more attention should be paid to children and the elderly. Some sort of legislation or policy should be put in place that during those critical times in the temperature alterations, certain quantities of medication that are highly used should be always stocked. We also thought it would be best for the Met offices to monitor the temperatures and inform the Ministry of Health when it was conducive to spray, when it was conducive to do the necessary things, and let the population also know some of the things they need to do to diminish the health hazards such as dengue fever. And we debated a lot about the fact that, I don't know about other countries, but for some of our countries, agricultural farmers really don't have any standards that they go through to take their produce to the market. And we just trust them and go and buy. So in situations where weather conditions might have caused diseases or something might have altered their crops. The farmer who probably lost everything and only has a few things which he thinks is good, or he or she thinks is good, and brings it to the market. We go in faith to buy, not knowing what might happen. So some sort of standards also needs to be established for farmers, we thought. And also regular monitoring of public spaces and work environments, working spaces for the temperature and for testing of molds and things that causes lung and chest infections, because that seems to be going high during high temperatures. And also some recommendations for private homes. You can't legislate or really impose on people in their private homes, but at least you can make some recommendations for them to put in place. But for public spaces and workspaces, even those that are privately owned, we thought some sort of regulation should be in place for workers. Thank you.
Yes, I think that deserves a round of applause. Thank you for sharing the discussion. And again, to remind people of the methodology, I mean, a lot of these natural disasters affect all of your countries, and so you can be taking notes within your grids and take them home. We will do our best to recap in our reports, but it's also a nice spot if something resonates with you. I'm now going to invite some sharing from precipitation and flooding, and it is going to be, there we are.
Okay, thank you. So precipitation and flooding, for health consequences, we have females that depend on the land as a form of living may suffer the most in terms of, if they are head of the household providers, they may suffer a form of mental stress, which will in turn enable them to maybe face physical, not be physically able to provide for their family members. Also, under health consequences, we have gastro. Normally where you have flooding, you normally have an outbreak of gastro. So what we have is that we should provide access to clean water because women and children are most susceptible to facing greater challenges where this is concerned, accessing clean water. And under responses to flooding, we have changes in the building code and also changes in the planning acts to include climate change infrastructures. For example, if you have persons that wish to build in areas that are susceptible to flooding, you would, as the government, you would let them know that certain allocations and initiatives will not be afforded to them. So basically, they'll be taking a risk of building in these areas. We also have consultations, of course, with individuals within the population that are affected or mostly greatly affected to formulate a response and relief plan. And we also have NIS providing coverage for a period of time. In Canada, I think we gave an example of 50 to 60% of the salaries being taken care of for a period of time. So, and then we also have disaster employment insurance, which could be an initiative taken on by the government provided to those affected. And one last point that we have is also military soldiers that could be deployed to these areas. And we also looked specifically at a good trained female contingent of military soldiers who are basically a part of the response team that are trained to deal with gender-specific issues where women and children are concerned. And that's our points for this topic.
Thank you. So we will move over to deforestation now. Can we have something for deforestation?
We're doing a teamwork approach on this one because deforestation didn't really resonate with the representatives at the table so far as the regions that we represent. So I'm going to just talk really quickly about some of the pieces that we did identify that are related. Indigenous people, especially in Canada, Guyana, very reliant on intact forests. And so the impacts that we identified that could be health related were access to medicine, plant gathering for Indigenous women especially, and also health impact could be if people move from country foods, very hunting oriented, quickly because of deforestation and lack of access to animals and prey and whole foods immediately to a processed food, then that's been shown to have really increased rates of diabetes and hypertension, health impact there. We also talked about, in my own area, 20,000 jobs have been lost in value-added forestry in the last 10 years because globalization and changes in rules have made that we export raw logs instead of doing the value-added work. And so that unionized jobs, full-time jobs, more men employed, but apparently an increase in alcoholism, drug abuse, violence against women as an impact of loss of those stable value-added jobs. So our first solution that we found was make your own toothpicks. It's crazy to grow the trees, export them to another continent, and then have them returned to us made by somebody else. So that was our first solution. But we've got a really good one from my brother in Guyana about a really innovative model that his country's negotiated with Norway.
Thank you. May I crave all of our indulgence and permit me to sit? Thank you. We do, I beg to disagree with my colleague, we do share some positions with respect to deforestation. And I do agree that this is going to be from a twofold perspective, because the realities of deforestation in the countries represented at this table are totally different. Some are affected by flooding, however, in Guyana, and I think it's imperative for me to give you a background on Guyana with regards to deforestation. And first of all, Guyana earns money for keeping its forests. So with regards to deforestation, we have a serious approach to that because we're being paid not to cut our forests. The country with 83,000 square miles and a population a little below 750,000 people. Vast land space. And what is our reality is that 90% of our population lives on the coast, which happens to be below sea level. So the imminent threat of flooding is our constant reality. But that is not as a result of deforestation. Most of our forest lies way in the interior, miles away from the coast. So, like I said, our reality compares to some other countries in the region and the rest of the world are vastly different. Additionally, so the fact that over 85% of Ghana, 85% of Ghana is covered with forests, which means that we hold a massive storage of the carbon that is important in the fight against climate change. And the Kingdom of Norway pays Ghana to keep the deforestation low, as I would have indicated, and more so as an early adopter of RED, the United Nations Support Scheme to Reduce Carbon Emission and Deforestation. Ghana, even without RED and the Norway's agreement, historically had its deforestation rate at very low percentages. So we had a consciousness even before we were being paid. So with that consciousness, I think the payment should be doubled. Yeah. And to re-emphasize our seriousness with regards to conservation, since the 1990s, Ghana to present would have contributed 18.47 million acres of our forested lands to this process to help the world with regards to our contribution in keeping the carbon emissions extremely low. And according to a recent study in the Science Advances, Ghana is the has the third highest portion of intact forests, which is only surpassed by our neighbors, Suriname and French Guyana. So our commitment to this issue is a very serious one. In Guyana, with regards to the issues of deforestation, we also factor in the reality that most of our indigenous people live in the forested areas and they depend on the forest for their existence, their survival, their way of life is dependent on hunting and using the forest as a means that, and fishing and using the forest as a means for their medicine. So all of these issues are factoring. So the Guyana Forestry Commission factoring in this reality and we have to utilize our resources. It's not to say we ain't gonna cut our trees, but our approach is a very responsible approach to how we cut down our trees. And we do a quota system. So loggers are given a percentage of logs. So we monitor how many trees are cut in whichever particular location these loggings are done. So Guyana has a database to track how many lumber is being cut, and by issuing tags to the various loggers, the Forestry Commission monitor when these loggers comes out of the interior with their logs. We can count all the logs, and if excess logs are cut and it is not tagged, the loggers have to pay a hefty fine for that. So all of this contributes significantly to us monitoring and having accurate data with regards to, and Norway as well is helping in this regard, because they're giving us our money. They want to ensure that we account for it. And I believe we're doing a tremendous job in accounting for that. And that agreement has been continued beyond the 5-year agreement that we would have inked with Norway. And the fact that this issue on a global scale is different, the policymakers' approach to it has to embody the realities that exist and craft a policy that is universally accepted, despite the differences that exist in every country, because some are affected by flooding, and the way of life of other people who live in that forested area with deforestation can also be affected. Additionally, the animals, their habitat, if we cut down the trees, their way of life is also affected by the movement of them to a different location. And the people who depend on the forest for medicine, if we cut down the trees and we supply them with medicine, their bodies are immune to the very medicine that the researchers go into the Amazon to seek the information from the indigenous people to come back and make the medicine, and then you go back to give it to them when you destroy the forest in the first place. So all of these realities must be embodied in our approach, our holistic approach, when we talk to the issue of deforestation. Thank you.
Thank you. Thank you for sharing that really interesting case on how Guyana is dealing with this, with deforestation or responsible management of their forests. Can I now invite, I don't know what table I'm at here. Oh, contaminación del agua, water contamination. So who at this table is going to, perfect, thank you. From Mexico.
Gracias. Primeramente quiero expresar mi reconocimiento y mi respeto a los compañeros provenientes de Cuba, Bolivia, Paraguay,
from
y
Cuba,
Perú.
Bolivia, Paraguay, and from Peru as well. But what I am going to tell you about, we are going to include all their points of view, and we all deserve to hear their points of view. I'm going to start in the following way. If there wasn't any water, the hurricanes, the increase in temperature, earthquakes and wildfires, deforestation, water pollution, and the other natural phenomena will not be important. And I would like to repeat that water is very important, because if there wasn't any water, we wouldn't even exist. And if we pollute water, that means that we put at risk the existence of humanity, and therefore we think that water pollution has very negative, more negative effects on women and children, because they are the ones who are more vulnerable than anybody else. With regard to consequences on the health, when we think about gender, we came to the conclusion that if there is an increase in diseases, mosquito-borne diseases in particular, the women who are pregnant and children as well, if they consume polluted water, then they will have problems. And there should be responses which are based on the law and based on legislation. And therefore, laws should be passed so that they can have products which would purify water. And there should be medicines which are the result of polluted water. In each population, there should be purifying plants or purifying centers for water. Because if there's a polluted water, then there must be measures that must be taken to deal with this. There should be funds that should be created that would deal with natural phenomena. Education should be reinforced with regard to the use and consumption of water. There should be laws as well, and I think that this is a very important point for the different countries who are here represented. There should be laws created which would make it clear and that there are donations. In the case of natural disasters, there are donations, but these should be done in a very transparent way. And therefore, solidarity is very important, because when there's a crisis, there is solidarity at the international level as well. And therefore, it should be very clear. There should be transparency with regard to the resources which are donated. And for us, this is all, and for the others, we give you more time to do your presentation.
I'll try to be punctual.
Ladies and gentlemen, Kelly Leitch for the wildfires.
And if you didn't know we were here, we're the smallest number of people, but obviously the loudest voice. Outstanding. So with regards to health consequences for wildfires, we separated things into two items. One is actual health, physical and mental, and then social determinants of health. With regards to physical health, inhalation injuries, violence, perinatal care were issues that could be gender segregated. And then on the mental health side, whether it be violence against women, anxiety of job losses, or late-term depression for women. On the social determinants of health, whether it be economic impacts that would cause loss of job, income challenges, so that may be due to loss of actual land or the equipment associated with being able to farm, housing, the need for specific housing projects, and potential, because many of these things happen in rural areas, that families may be separated and having to find housing for different members of family members before bringing them together again. And then the last social determinant of health to focus on is education, particularly in my opinion, we find a number of mothers end up homeschooling, and that may take them away from being able to actually tend to themselves or to other issues. With regards to legislative responses, three large buckets, one being sort of national financial investments, so whether that be for restorative health services that could be segregated male, female based on the issues I mentioned before, or in the case of Canada, we do a dollar matching program so that local communities can choose how they target their funds and take care of the issues they know are important in their local area. Education, so training young people in particular in the primary education programs how to react to these issues. Not every child necessarily knows how to swim. Not every child necessarily knows how to react to a fire. Not every child necessarily knows how to react to a flood. And so primary school education being important for evacuation purposes. And then the last thing that just came up earlier that I think is something that can be legislated, something we've done in Canada, are national building standards. We have the Canada Building Code, which is actually used internationally, but there are other standards that were mentioned earlier that can be legislated for to make sure that those that are doing rebuilding or actually doing relocating actually have a standard level to follow. And the Canada Building Code is done by our National Research Council. It's free to the world, so if you'd like access to it, happy to talk to you about that.
Thank you. Thank you. The interesting thing about those kinds of standards for infrastructure projects and building is my colleagues at the UNISDR. I've been trying to really also get out there this idea that we need to be integrating into that process disaster risk reduction and planning for disaster, right? So if we can have standards that are really already taking into consideration ways to mitigate the effects of disasters as they become more prevalent. Earthquakes. Who at this table would like to present on earthquakes?
Gracias, pues primero agradezco a mis compañeros porque
Thank you. First of all,
todos
I'd like
hicieron
to thank my
aportaciones
colleagues because they all made very important contributions, and we were even very much in agreement with most things. We dealt with the issue of earthquakes, and in Mexico we have a lot of experience with this. We were talking about our different experiences in our countries and the differences between earthquakes like the one that took place in 1985, which left more than 1,000 dead, and one that took place in September, which claimed 369 victims, 369 fatalities. As our friend was saying, there are construction codes that are often ignored in construction, and this is why this last incident left so many dead. Also, it's an issue to do with construction, of corruption in terms of the issuing of construction permits. One of the things that we identified is that the populations close to the epicenter would probably suffer more damages and more injuries. There would be psychological effects, particularly women, because of the tension and the stress of being responsible for children. The damages to health and educational institutions, as well as reviewing media coverage. And we included this because in Mexico, we noticed that help did not come to every place that needed it. It focused in certain areas, which were in fact the areas that the media was covering the most. So there were other areas that needed more help, but because of the media were focused in other areas, all of the assistance flocked to those areas being covered by the media. We spoke about different examples of funds. In Mexico, we have Fonden, managed by the governance secretariat, the government ministry, and a proposal by our friend here, which I think is very interesting, would be for this federal or national fund to be accompanied by national funds or state-level funds, depending on the administrative division. But for instance, the states or the areas that have a higher propensity to suffer from earthquakes would manage the fund, but perhaps having other states also contribute to the fund so that the resource base is greater. Because when a crisis strikes, usually you want as many funds as possible. We also spoke about insurance, because quite often there's a crisis and people lose everything, and the state cannot always absorb all of the costs of recovery. There are other issues that would be relevant for our legislature, but perhaps paid leave for children that have, for people who have children who attend educational institutions who were affected. For instance, in this last earthquake within the states, within Mexico, there were 14,000 schools that were affected, and it took a while for them to return to normal operations. And then it turned out that the mothers ended up having to stop working or to ask for leave. Some of them had to quit their jobs entirely in order to care for their children while they were out of school. So we would think about instituting some sort of parental leave or some sort of family leave to cover these circumstances. Something else that came up in our discussion was to have real census data. Quite often, we're not sure of how many people live in a particular area or how many rooms were in one particular house, how many areas had a particular building. So we had instances of people coming from other provinces saying, yes, I used to live here, this is where my house was, and it turns out that that's not the case, it's fraud. So we need to have up-to-date, accurate information. Thank you very much.
Thank you very much for that sharing. And we're going to move over here to Drought.
Good afternoon, everyone. Now I'm speaking on drought today, and drought personally affects everyone. Reason being is because water is not a want, it's a need. Right? In terms of the health consequences, water automatically affects gender. First being women at the top of that. One being personal hygiene. Because women go through so much in terms of personally developing, in terms of the cycle, those who having babies, those who go into work, water affects them personally at the highest. Yes, it affects men, but men do not require as much water as women. The diseases that impact gastros, pink eye, the common cold because you can't wash your hands or do different things. It also affects the food supply because without water, the farmers cannot water their plants, their crops dwindle. They now have to allocate food supply to the highest bidder or those who can afford it, right? Secondly, it slows down the workforce because without water, a building cannot run. So it affects, that is the health consequences, the gender consequences, and just the social consequences of what a drought can do, right? In response to that, what the first response must be is a strategic emergency response. Knowing the drought before it becomes too late. Gathering data on the community and seeing the areas that will be more affected and those who would need water in households that have more females and less males, in terms of evenly distributing the water, in terms of that response. Also the building code. Equal distribution by the government when distributing water supply, like WASA would respond, in Trinidad WASA would respond to drought, but if WASA cannot respond to drought, you also want to partner with different people who would help with that response in terms of Blue Waters, external countries who would be aiding towards assisting during the drought process in case the drought runs longer than it should. We had an issue in Trinidad here a few years ago where our water supply almost dried up and we almost did not survive that, right? Also, water conservation, education in terms of water usage, because personally, when you give water to people, in terms of the household, they don't know how to evenly use the water. Who would need more water? People still want to make teas, people want to make juice, people want to make different things, and they still want to go about their regular life, right? And water in your plants, so the water conservation comes within that, and water education, right? The water storage in terms of communal tanks needs to be implemented and enforced. That the community itself needs to have a adequate tank supply of water within the community, especially to the community center. Security for distribution and the even distribution of water is necessary, because they're going to have a rush for people who want water, and not everyone is going to get, because people tend to be greedy or abusive when they need something, right? So last but not least, the distribution of chlorine tablets in terms of water purification. because during the water drought, you tend to have inadequate, well, not inadequate, but some of the water might not be clean. So in order to ensure that disease doesn't run rampant, the purification of water and the distribution of the tablets needs to pass along. And I think it really affects not just women, but kids as well, because kids who have asthma is affected, and the response to that is usually to dampen the rise of dust during the course of drought. And I wouldn't speak any longer because most of the examples shared here today will touch on what drought is. But what I would say last is that the very water cup you have in front of you, if it was not there, you would not be able to drink it, and this would happen.
Thank you very much. A round of applause for this table. Sea level rise.
Our topic is sea level rise, but we have chosen to modify it somewhat so that it speaks to water level rise. And the reason we decided this is that in some of the mountainous islands, we have rivers and lakes. And so we looked at the example of Thomasos in Haiti and the rivers and the rivers in Grenada, St. Lucia, Dominica. So one of the things that we have to budget for immediately is not only ground transport, but sea transport. Because when these rivers rise, the only way that we can get the population out is down the river and through the sea. Now we looked at the health consequences, and of course with the rise in sea level and other water levels, there are infectious diseases, insect-borne diseases, and waterborne diseases. That's on the physical side. On the mental side, we saw the elderly become isolated, depressed, and in the agricultural areas, the farmers especially feel displaced, crops destroyed, etc. And so we looked at how we would budget for all of this. First, vaccinations. We need to budget for vaccinations, portable toilets, especially for women, as our table on water drought declared. We need to have access to bottled water and legislation regarding desalination, because in some of our territories, we protect our water companies. So when that is down, we need to have something temporary. Also, we looked at temporary shelters, gender-friendly, gender-responsive, temporarily trained security forces. We also looked at budget for psychological and social workers to administer generally to the public, but in particular to children that have been displaced and or not at school. Also, generally at this time, men find work in construction and the women are displaced. And so we have to consider either the retraining of women or some temporary fund that can keep the families going in the meantime. We also have to budget, especially in the rural areas, for new seedlings and crops for agriculture. And finally, we said, as a preventive measure, there should always be a crisis or emergency fund that government has at its disposal and can tap into in crisis. Thank you.
Thank you very much for sharing the perspective from the discussions that you had at your table. And we're going to go to the air. Kind of like water in that it's essential. So here we are, contamination of the air.
Bueno, en Esta comisión ha sido una comisión casi todas las Naciones Unidas acá.
Our group is basically a commission which includes a lot of the UN, Mexico, Bolivia, Ecuador, Peru, El Salvador, and Chile. And we dealt with air pollution as our main topic for discussion. We identified impacts, including respiratory illnesses and the increase in the use of hospital services, urgent care visits, heavy metal pollutions in areas where mining activities and hydrocarbon exploitation activities take place. We talked about two types of air pollution, one due to natural phenomena or natural disasters. For instance, many of our countries have volcanic areas and their gas emissions need to be taken into account. They're very difficult to control. But there are also gases and effluents that come about because of human activity. Among them, from mining activities, hydrocarbon exploitation, and all of the polluting activities that arise from industrial activities. Another contaminant that we mentioned affects the electromagnetic spectrum, which affects human health as well. In agriculture, there's also the use of pesticides. These are the issues that we identified, and we therefore asked ourselves, what do we do about all of this? What would be the consequences? First of all, there would be decreased attendance to schools and to workplaces. And as usual, those who bear the brunt of this is women, who are then left having to care for health issues, because of course when a child is ill, it is usually the mother who has to respond, and that should not always be the case. This is exactly why we're here. There's also a lack of medical assistance, medical care, scarcity of food resources, lack of regulations, regulatory protocols on toxic gas emissions, whether they arise from natural phenomena or industrial activities in industrial areas, mining or hydrocarbon exploitation activities. But there's another issue that leads to air pollution, and it's something that's crucial in many of our areas. And much of, for instance, is contamination due to mining. Many companies come to the Americas from Europe, but when they work in our region, they do not uphold the same health and safety standards that they would uphold in their own countries. They treat us in the worst way possible. And so here we have to improve our health and safety standards. And I'm going forward a bit, I have to go back. Another issue is accidents during the transport of inputs for the mining and hydrocarbon industry, and these are often very polluting. Then the transport itself of these inputs pollutes the air as well. And another thing that I had mentioned already is pesticides. All of these pollutants are present a challenge. And so the response would be prevention plans and practices from mining, agriculture, and areas subject to natural disasters, such as volcanic areas. There is a lack of and for this we need legislation to regulate, plan, and sanction all activities that lead to polluting gas. Another issue would be legislating on gas emanations, including legislation about illnesses that arise from such emanations. For instance, in mining areas, there are people with high levels of heavy metals in their bloodstream. And of course, these heavy metals are due to gas emanations. So we need legislation on this front. And also regulate, plan, and sanction activities related to environmental health in these areas where there is a lot of gas emanations. This is the extent of our discussions.
And look, there would be so many ways that I could try to unpack all of this and pull it all together, but for lack of time, I do think a lot of it you all can draw together. How this relates to much of what we listened to this morning. Certainly I did hear a lot of, and it's good, what I heard a lot of is there's a lot of need to address things from a gender perspective, and I think that the base of that, though, to know how to respond is still, it's that issue of data. So you need to go in planning. We need that disaggregated data to understand how and how the different people are going to be impacted, so that all of these plans, all of these actions that you mean to address, that you have the ability to understand how you're going to effectively make those changes. I did have, is everybody okay? Like, I have a plan to catch up. I do, I always do, actually, and we won't be too far behind on our time. But I did have a colleague who suddenly has disappeared from Peru, who made a point that he really wanted to ask a question from our earlier panel. Well, you know, I guess he disappeared just at the wrong time. So I don't think we're going to have a lot of time to. So I will say, what I'm going to offer is I do have like 5 minutes here. If there is 10 minutes maybe, a pressing question that hadn't been addressed yet in this morning's session, or if we should just move on to the next part of the agenda. Minister, please.
Direct my question to Ms. PAHO. For the past 3 days, except this morning, I would not have heard the mention of LGBT. And so I am wondering, where does this grouping fall in the whole gender issue? If we are to accomplish gender equality, and if we are trying to maintain the status quo in leaving no one behind, I am wondering if the subject of LGBT as a grouping, is it a case of taboo why we are not discussing it, or will it be discussed in another forum? In addition to that, I have not heard anything specifically with regards to, what did you talk about again? Sexual and reproductive health. I have not heard a wide discussion in those two areas. And so I would just want to know, what are the plans for these two subjects in particular moving forward?
Thank you, Minister.
Peru is experiencing a very serious problem over the past few months. The problem of femicide and violence against women has come very much to the fore. And it's often, and this is very graphic, but perhaps you've heard of this, sometimes a man will board a bus and will simply pour gasoline on a girl, on a woman, and light her on fire. And it's not even that he was a partner of hers, he's just obsessed with a girl. So this issue of gender equality between the sexes, I think paradoxically what's going on in Peru, it's very complex. And it has to do with understanding what is gender. Even some religious or conservative groups are terribly upset whenever the word gender comes up in legislation or in any documentation. They want it removed. And they say that it's because the word gender is associated with the propaganda of gay groups who want to homosexualize, let's say, the whole of society. And I'm sorry to say this, but this is an open debate in Peru. And so I wanted to hear from the colleagues and the experts, our parliamentarian colleagues, whether you have any experiences on how to educate the society, how to inform the society. There's a lot of ignorance, a lot of awareness. We do need to develop the gender perspective in order to understand relationships between men and women, and particularly the respect that we should have, because the violence against women is very much associated with misogyny, with machismo, and with the patriarchy. And though I'm very proud of my country, it's a shame to have to admit that my country is very machista. And so a lot of men feel like they are better than women, like they're more than women. And so we need a lot of education on sharing roles, that carrying out domestic tasks doesn't make you less of a man. And to work with boys as well. And there is that very distorted view by religious groups who are trying to, and they're not even just against the gender approach, but they are against a version, a distorted version of what the concept of gender is and what it entails. And so I wanted to hear about any experiences or lessons that we can apply to deal with this in our country.
Thank you, and forgive me if I didn't capture all of what was requested, but certainly from the Pan-American Health Organization perspective, I would quickly be able to state that we have a commitment and a mandate given by the member states, all member states in the region of the Americas, to mainstream gender equality in health. That's one framework that we have in existence since 2000. Long before that, we have a clear commitment to support countries in their efforts to achieve health for all, and now under the umbrella of universal access to health and universal health coverage. We recently have a new resolution approved by all member states on the access to LGBT health, or I should say the access to health of LGBT persons. This is the first of its kind resolution in all the regions of the World Health Organization, and it is just another way in which countries are confirming their own national mandates with regards to human rights. And within this discussion and debate for the past 2-3 days, the issue of climate change and its possible impact on health perhaps the issue of LGBT health did not come up specifically, but we certainly from the Pan American Health Organization would remind member states that it is an essential part of fulfilling the human rights of all, every person, everywhere. But the challenge is not in adopting a resolution that will enhance the right to health, but in implementing the resolution at the same pace for every member state. And so if the issue has not come up clearly, we would encourage you to further consider that, but to also know that entry points exist all along in different ways, and your advocacy at the national level will continue to place that on either national, sub-regional, or regional agendas for a next encounter to, again, more strongly place what is the position with regards to the right to health for LGBT persons. So that part is where we are. This is a new area. Actually, there is quite a difference in the way in which legislation is responding, but that this is a concrete gender equality issue. Of course, we will all agree to that. The issue of gender-based violence came up several times, and the essence of gender-based violence is exactly that, the violation of human rights and a public health concern. And so the issue of mortality, the issue of femicide, the issue of a culture that continues to control certain groups, in this case the rights of women, in the case of LGBT population, new gender identities, is in reality just asking us to reflect on what are the unequal conditions that exist and how much harder we need to work at making them real priorities that can be implemented. There was a question about sexual and reproductive health as well. I think in the panel that we had on health, the issue was brought up with regards to access to specific services during an emergency or a disaster response. In reality, providing sexual and reproductive health to our region is a mandate that we have some deficit on, and we're working hard towards that, not just the Pan American Health Organization, but in an interagency approach. There are clear responsibilities and mandates across the UN system. The challenge really is that countries advance sometimes, and then suddenly certain national changes introduce new ways of looking at the same issue, and then the momentum is lost, and countries have to garner efforts and initiatives again to continue the process. We are still debating, for example, in the region of the Americas, how to best introduce comprehensive sexuality education in schools. And this is an elementary condition of a right to access to information on sexuality for all our peoples in the Americas. And so we have to continue to coordinate our efforts to elevate the discussion on the rights of all our people, and at the same time provide opportunities for there to be progressive change and measurement of the change. If this is not the forum for specific discussion on sexual and reproductive health, it certainly is the forum to be reminded that gender equality in providing sexual and reproductive health services in the event of emergency and disasters has to give all of this consideration. But there are other entry points with regards to providing comprehensive sexual and reproductive health services across the region.
Thank you very much. Look, I think we do need to move along in the agenda, because there still is. We have the declaration of our event that needs to be read. We've worked very hard. It's already been pre-circulated, so I think everybody's had a chance to look at it. But we do want to make sure that we're all leaving here with a document from these proceedings. And so I'm going to invite Senator Mobina Jaffer, who is our Vice President for North America for the Parliamentary Network for for Gender Equality to come up here and join me, as well as I'm going to invite Madame Speaker to come up and join me, because she will be presiding over any discussion of the document. So the document is being circulated again in hard copy. You all will have received this declaration prior, and we had taken some feedback on it. And so here's what, after the feedback received, this is the document. And so we invite you, perhaps, I don't know if you just both sit in the comfy chairs. Let's just make sure they get the document. Senator Trevor, did you want to stand at the podium or do you want to sit? Your choice. What's your comfort? Okay, and you'll just wait. Annabelle will come sit with you too to help with that.
Madam, if you'd like to speak from there.
Is that an okay height for you?
So everybody has the document in front of them? Yeah? So this is our declaration, the 10th gathering of the Parliamentary Network for Gender Equality. Knowledge on good practices for gender mainstreaming in assessments and planning for climate resilient future, with the understanding that threats and impacts are not gender neutral, and that women's empowerment is necessary for adaptation and the achievement of all sustainable development goals. We furthermore discussed the importance of gender-responsive budgeting as a mechanism to support equitable and efficient resource mobilizations benefiting all members of the population in accordance with their differentiated needs. In view of the above, and recognizing that climate change poses a severe global threat to our future, and that responding to climate change requires immediate, concerted, long-term planning and action in order to preserve development gains and to achieve the goals of the 2030 Agenda for Sustainable Development, including SDG 5, to achieve gender equality and empower all women and girls. That climate change and natural disasters are negatively impacting many areas of the Americas and the Caribbean, including ecosystems, human well-being and health, and social and economic stability, and that many countries in our region, including small island developing states, face particular challenges in these regards. That women and men are differently exposed to and affected by the risks and consequences of climate change due to gender-based inequities in access to assets and economic resources, participation in all levels of policy and decision-making processes, and socio-cultural norms. That developing and implementing effective and fair climate solutions requires governments and legislatures to effectively incorporate a wide range of actors, including civil society groups advocating for women's rights and diversity. That systemic barriers can hinder the ability of women, indigenous communities, and other traditionally marginalized groups to fully contribute their knowledge and expertise to the planning and implementation of climate action at local,
national and international levels, that legislatures and individual parliamentarians, through their oversight, representative and lawmaking functions, play a vital role in shaping a development vision that connect the inherent links between gender equality and environmental protection, and in ensuring that disaggregated data and gender-responsive budgeting are employed as tools in realizing this vision. That international agreements and bodies support the coordination of relevant decision-making and can guide national action on climate change from a gender perspective, including the 2030 Agenda for Sustainable Development, the Convention on the Elimination of All Forms of Discrimination Against Women, the United Nations Framework Convention on Climate Change, and its supreme decision-making body, the Conference of the Parties, the Paris Agreement to Combat Climate Change and the corresponding national determined contributions, the Sendai Framework for Disaster Risk Reduction, and the UNFPA's Gender Action Plan, which can be employed to spur and oversee progress. That building national capacity for gender-responsive climate change adaptation and emergency responses is essential in our region and must be done through collaboration between all sectors and at all levels, and include public and private institutions, legislatures, and society at large. That our changing climate creates new and complex health risks which can be exacerbated for individuals or groups who are marginalized based on gender and other intersecting social and geographic factors requiring stronger public health systems. That parliamentarians can help to foster the international and intersectoral cooperation needed to develop and implement inclusive solutions aimed at building climate resilience, and to strengthen diplomacy and cooperation in the region to promote dialogue and the exchange of best legislative practices that can contribute to the adoption of more gender-responsive legislative action. We commit to, 1, using our public platforms to raise awareness about gender differentials in climate change and the urgent need to reduce disaster risk, and to promote women's equal participation in climate change decision-making and negotiations and in emergency response planning. 2, promoting gender mainstreaming in parliamentary work on climate action and the development of national budgetary tools and policies to consider the different impacts of spending and taxation on women, men, and traditionally marginalized groups as relevant to national context. 3, fostering a political environment that is conducive to gender-responsive implementation of international climate change agreements and action plans supported by national-level policy frameworks and transparent and inclusive consultation processes. 4, working alongside our governments and societies to address the entrenched sources of gender inequality and poverty which limit the ability of women and traditionally marginalized groups to adapt and respond to climate change threats and impacts. 5, encouraging our governments and legislatures to conduct gender-sensitive national and subnational assessments on health risks associated with climate change to strengthen public sector responses to the specific vulnerabilities of different population groups. 6, overseeing and accompanying our government's engagements with international agreements and tools related to gender-responsive policy making on climate change and disaster risk reduction. 7, promoting collaboration between national and regional stakeholders such as local women's organizations, scientific bodies and academia, private sector and government agencies in order to find common solutions to climate change challenges and actions to address them. 8, strengthening interparliamentary and intergovernment cooperation and the exchange of best practices and tools related to incorporating a gender perspective in the fight against climate change. Signed in Port of Spain, Trinidad, Tobago, May 24th, 2018.
Thank you very much, Vice Chair. So we've read the declaration, and I now invite from the floor any comments or any suggestions any member would like to make to maybe amplify this. Yes, I recognize the delegate from Haiti.
Merci de m'accorder la parole afin de faire deux petites remarques. D'abord, si on peut prendre à partir de en reconnaissant dans la version française.
Recognizing in the third paragraph starting that women and men are differently exposed and affected by the risks and consequences of climate change due to gender-based inequities in access. I think that we should have not inequity, but inequalities. That's different here. We were talking a lot about equity and equality. And further down, the 8th paragraph, no, the number 8 in we commit to, strengthening interparliamentary and intergovernmental cooperation and the exchange of best practices and tools not linked to incorporating or related to incorporated. Or there's a formulation in French that he thinks should be changed, not the meaning, only something to do with the language. Point number 5, instead of encouraging our governments, another linguistic addition, just for the French version here.
I just have one suggestion. If you look at paragraph 4, and considering we've had civil society with us all week, to say working aside our governments, civil society and community. Thank you once again. I think that we should have a harmonization with the different points of view that have been expressed by our different countries. And I think that we should include we could think about dolphins and their situation, and we should think about the protection of the flora and the fauna, because in Mexico, the elephants and the lions are animals which are exploited in the circuses. In Mexico, we have made progress with regard to this issue, and I think that the protection of these animals should be included, and therefore, in addition to protecting these animals, because if we don't do it, the planet will come to an end, because after human beings, we've got animals. I think that in the last 100 years, human beings have increased. And at this rhythm, in 50 or 60 years, we are going to be fighting for land. And therefore, I think that we must pay attention to this, and this is an issue that ought to be reflected here.
The importance of the point you made with respect to the animals and the flora and fauna. It is something that we would take note in the record of the proceedings, but in terms of the actual declaration, We think it's outside the scope of it, but it is going to be mentioned in the record of the proceedings. Okay? See? Yes, ma'am?
Paragraph 2, this the climate change is a grave menace to our future, and it is also a menace for the ecosystems. And I think that we should include all the systems that exist on the planet, because it is, when we talk about life systems, I think that we should include the initiative that has been suggested by Mexico, but we could perhaps use a different language, because all of this has already been discussed and included in the conventions which have been adopted in COP. And we would also like to move on to page 2 in the 6th paragraph. I would like, here we are talking about adaptation to climate change. There's a lot of issues we discuss with regard to the adaptation, and we should improve, and we should include here the issue of resilience and the issue of adaptation. I think this is what I would like to say with regard to paragraph 6. This is what Bolivia would like to propose as an amendment.
We will include that in the final declaration. Okay? See? Yes? Delegate from Canada.
Also on 6, it feels like there's a word missing, or else it's not clear what the action is. What is being overseen and accompanied? So that's simply a question of explanation. But the proposal, the change I'd like to propose, do you amend the preamble, the whereas section? Because on page 2, the second paragraph that describes the international agreements, it says they can guide, they can be employed. And I'm brought to mind of the very powerful intervention on the first day, where I think the minister from maybe Trinidad and Tobago had the list of commitments going back to the 1970s that have not been acted on. We had, I think the minister from Jamaica said, I am growing old talking about climate change. So can we say in that paragraph, listing the international agreements, that they should guide national action, that they should be employed to spur and oversee progress? Because we're stalling out. I'm not feeling the sense of urgency in this document that I think would reflect the conversation we've had. Thank you.
So it would be which replace can with should or must. Which I'm not sure that shall grammatically is correct there. So it's either should guide or must guide. Okay? So we will settle for should guide. And in terms of 6 in the commitments, I think the overseeing relates to our government engagements. So we oversee and accompany our government commitments. So accompanying, I guess, there means support, and overseeing is in terms of monitoring.
Is the tool the international agreements?
No, I would think there are two different things. There are agreements and there are tools, just say, for instance, with ParlAmericas. they provide toolkits which are like guides for implementation. So one is the agreements. And for instance, let's take the Sendai agreement. There are toolkits that go along with it. So one, we monitor, overseeing, and the government's agreements, these international agreements, and we also support them, and we also oversee like the implementation of the tools and the use of the tools which are prepared. Okay? All right. Thank you. Dana? No?
With regards to the international agreements, I believe the implementation should be based on the indigenous nature of each state, because what works in one state may not necessarily be the best practice to be imposed or implemented in that particular region. So it should be one that embodies the reality that exists in the independence of each country or state where we want to implement this agenda because of our differences and our uniqueness. What I might find acceptable, you may not find acceptable.
Yes.
And that is the reality of the world because of our differences, and that definitely should be considered.
Yeah. I think, though, that the word our governments, I don't know if the word respective might help, but our governments, I think, is what relates to the point that you are making, in that it's not that it's universal, one size fit all, but it's relating to your specific government's agreements that it would have made with the international bodies and their engagements.
For example, the signing of certain conventions, 90% of it may be good for a country, but the other 10 is not good for the country. So what does the country do? Do not sign to it? No, they sign because the plethora of benefits that can be derived by signing is good. But the reality on the ground is that the society may not be in favor of 10% of what they would have signed on to. So what do? Do we force them to accept what the society does not accept? So in that respect, I'm asking for certain considerations to be put forward, because our realities in the world are different.
Yeah. So what may I suggest? What may you suggest?
That is in the best interests of the country or state.
Yeah, I think that is something that could be included in the wording. Okay.
Great.
Is it
Greatly
Neves
appreciate.
Anguilla? St. Kitts, Neves.
There is no highlight really of women political participation. Probably it was the intent in number 4, but I would prefer to see that as a bullet point set on its own, as opposed to being camouflaged, so to speak, in any of the given agreement. I think it was the intent in number 4, but I prefer, based on what we obtains in the region and what we have heard, the desperate plight of our sister in Haiti, I would like to see it as a bullet point on its own.
Yes, I think that point is readily accepted. Thank you. Member for Canada. Excuse me? I think, 1 minute, please. I think you had indicated. Okay. Yes, Haiti, sorry.
Merci beaucoup. Hier,
Mr. Beaumont, Senator from Trinidad and Tobago, I think, raised the question of the difference between equity and equality. Today, Mrs. Cuellar from Belize said in her presentation that equity is the way and equality is the result. I think we can come back to this terminology if we have time. But I would like to draw your attention to the third paragraph in the recognizing section. In the fourth line of this paragraph, gender-based to fix gender-based inequality. So this is the problem here. We are not equal. It is a fact. We cannot say that we want to reach equality. We are not equal because naturally we have strived for equality in 1789 during the French Revolution and the Haitian Revolution of 1804, where we're talking about freedom, equality, liberty, equality, and fraternity. This is only in right, not in fact. So, in the spirit of equality, between inverted commas, I think we should say gender equity. In the French-speaking world, whether it's in Haiti or in Canada or in metropolitan France, we have adopted officially the term equity, gender equity, and not gender equality. Let me give you an example. I am not equal to Mrs. Etienne, my colleague, senator. She can bear children, I can't. We are not equal. We can strive for equity, but not equality. So I would rather we used only the word équité in the French version.
Well, I don't know.
On n'entend pas là. L'égalité ici, ça fait référence à les domaines dans lesquels on peut être égaux. C'est rhétorique. On est naturel et physiologique dans lesquels nous ne pourrons jamais être égaux. Mais le mot égalité
I don't really see the need. I mean, if this exercise is going to take us into the degree of precision which seems to be emerging, we'll be here for the whole day. I think, quite frankly, I see no need to change the word because it must be contextually understood. It can't be understood that reference to equality is impossible between men and women because they have different biological constructs. The word equality here is contextual, meaning we are equal in the things which give us rights as a human person. And therefore, I think we should get on with it.
Okay. I've heard the points in terms for the delegate of Haiti. In terms of the United Nations, the term that we use is equality. I do appreciate the point about the difference between equity and equality. But I think you're quite correct in that what we are striving for here is the result. And from what you've presented, the result is what results in equality. So I think for us, we will stick to the standard word used by the international agencies, which is gender equality. And I think the mischief that you're trying to really bring to our eyes, we appreciate that we're not created equal in that sense, that there are differences, but in terms of rights, that in all aspects, the equality of rights is what is recognized. Okay, I think the President of the Senate for St. Lucia, I recognize you.
I have a very minor, non-controversial comment. At the bottom of the first page, I think that should be connects. S and not connect. Play a development vision that connects. Thank you.
Thank you very much. Okay, so shall I then ask by a collective voice, do we generally agree with the amendments that were proposed? Yes? And therefore, I now say that somebody moves that the declaration as amended be. Okay, I recognize the delegate from Canada.
The entire morning talking about healthcare related issues. And one of the items that's outlined in the document on the second page in the English version, the fourth paragraph, speaks to the last three words being public health systems. We were talking about more than just public health today. When you speak about public health, it talks particularly to the social determinants of health, but not actually the actual health care component. And so I wonder if you would consider changing the language to say stronger public health and integrated and resilient health systems. You know, it's what we spoke about this morning, it's what the UN does speak to, but that way you're incorporating both the health care aspect as well as the public health component.
I think we can accept that. Thank you very much. Okay. Thank you so much, President of the Senate. And thank you very much, Delegate from Guyana. And therefore, all in favor? Any against? The ayes have it. I thank you very much. We do have a declaration.
Thank you so much, Madam Speaker, for presiding over that. Look, we have just a couple of points of business. They're very quick before we move into our closing. And so we will move on with that. We have lots of energy today. I'm actually, well, as my colleague is handing out the evaluation, and everyone knows that at ParlAmericas, we work very hard to build these programmings for you, with you. In fact, and that's going to be the next point I'm going to make on the with you part. Part of the with you is that we do ask you to fill in our end of activity evaluations. These are very important to us. They're also very important to so that we can make sure that we have a better record of your thoughts on the activities and we can strengthen them. The other part of with you, though, is as these are being passed out, I'm going to move into just an announcement about our executive committee for the Parliamentary Network for Gender Equality. So for me to explain, we are here at the 10th gathering of that Parliamentary Network for Gender Equality. And what that means, what this is, it used to be called the Group of Women Parliamentarians. This has been the priority pillar of ParlAmericas since 2003. And this network allows us, or how we build networks around our priority thematic areas. Within this grouping, we do elect what we call an executive committee. And this allows us to have specific individuals who have put themselves forward to help us build the programming so that it's inclusive of the perspectives of the parliamentarians who we wish to build the programming for. So I am going to, in great ParlAmericas fashion, we're not actually having an election because we tend to work this out by consensus. We're very pleased that there's a lot of interest in working on this executive committee. And so I just want to announce the results because coming into this gathering, it had been announced, we had put out that we were accepting nominations for 2 vacancies. We had a vacancy for the vice presidency for South America, and we had a vacancy for the vice presidency of Central America. And so I wish to express that we had a lot of interest, particularly from South America. And so, in fact, we came in with a vacancy, and we were exiting with two. Two countries have agreed to, two candidates have agreed to jointly support our network from South America that way. So if we could just put up the results of that. So here's, do we not have the other slide? I mean, this is the end result. No, anyway, just put up the big one and I'll explain it verbally. This is showing you the full committee now. So at this gathering, I do want to recognize Cristina Cornejo from El Salvador, who is joining our executive committee representing Central America. She has also recently joined our board of directors, so we're very pleased to be working with her on this. So can you please help me congratulate Cristina? Can you stand up so everyone can see who is going to be representing Central America in our working group to build the programming for this? And we also wish to welcome Karina Arteaga from Ecuador, who is joining us as the Vice President for South America. Please do stand up so we can recognize you, please. We're very pleased. But as I said, we had great interest from South America, and there has been an agreement that she will have an alternate vice presidency from Chile. So Marcela Sabat Fernandez will also be joining. Unfortunately, Marcela had to get on a flight, so she has she's very pleased, but she's not here with us for us to applaud her. I'll let her know. And then this just shows you who is been working hard on that. And as you've seen through today's proceedings, we do have our vice president for North America, Senator Mobina Jaffer, and I do wish to acknowledge and thank her for her support in this program today, as well as the Honorable Chester Humphreys, the president of the Senate of Grenada, who is also our vice president. So that's so you understand how we design the program. It's not just our hard work. I appreciate everybody saying thank you to the International Secretariat, and I in turn want to say thank you to the hard work of the parliamentarians who work so closely with us through this mechanism. So that's that announcement. And with that, as you finish up, I'll give you a couple minutes to finish up your evaluations, and we'll move on to the closing ceremony. Okay. If you can just, if you hold them up, and my colleagues can pick them up. And we're about to move into the closing ceremony. But I do want to take this opportunity before I pass it over to our host and the Vice President of ParlAmericas to close this on behalf of the organization. From the International Secretariat, I just want to say thank you so much to the Parliament of Trinidad and Tobago for all of your support in putting this together with us. It's been an amazing collaboration, and we're so pleased to be here. And then I do want to acknowledge the support of the Government of Canada through Global Affairs Canada, who gives us some financial support for putting on this programming as well. And so I would be remiss without mentioning one of our major contributors and donors as well. So I am now going to invite, what's the order? Yes, which makes sense. Yes, the Honorable Bob Nault, who is the Vice President of ParlAmericas International, who is coming to give closing remarks on behalf of the organization. Thank you.
Ladies and gentlemen. Okay, so the first thing I want you to do is close your eyes and just think that you're at the Exodus Panyard. It'll make your day a lot happier if you just think about what you were doing last night versus what you're doing now. And remind ourselves of how much fun we've really had here in Trinidad and Tobago, and thank our colleague for taking us to his riding, Mr. Ford, and let's say thank you very much, because so it seems to me that every 5 years I get a chance to dance, so that was the time I had. So I just want to say thank you very much for that. So colleagues, I don't want to repeat what many have said, and I know we're running late, so I got a couple things I want to do. I want to, as we conclude the 10th gathering of the Parliamentary Network for Gender Equality, I'd like to thank all of you for your active participation and important contributions over the past 3 days. In particular, I want to thank the Vice Presidents who are here. There are a few of them, and congratulate those who have been I think, elected by their colleagues internally to support the Gender Equality Network, which is, as you know, our first network that was created when ParlAmericas started, and is one of the most successful. And I want to thank Chester and Mobina and others for their fine work. I also want to pay particular attention to the actions available to parliamentarians who would support efforts to ensure the existence of gender-responsive climate strategies, policies, and programs at both the national and regional level. And I want to repeat what I said yesterday, again today. It's really about us and our political leadership if we're going to move gender equality, if we're going to move to issues that are important to all of us. We have to go home and do the hard work that remains to be done. I would as well like to extend our sincere thanks to the panelists and the moderators. It's always hard work to be a moderator in particular, and who provided us with very valuable insights, and I want to thank all of you for that. I would particularly want to thank our hosts and thank Bridget very much as the Speaker of the House of Representatives of Trinidad and Tobago. As you know, organizing these things aren't as simple as we might think, so I want to applaud the fine work of our Speaker. Lastly, I want to thank Alicia and her team for putting a lot of work and effort into all of this. It does put a lot of time and effort to get us here. And I know that if some of you are just starting off in ParlAmericas, ParlAmericas has got an extremely good reputation in Canada in particular. We speak of ParlAmericas a lot, and I'm sure you do in your own countries, and I think we're gaining that kind of respect because of all the hard work that we're doing. And so keep up the good work because it's important that we are consistent in our application of our work. So I again want to congratulate the new members of the Gender Network and wish you all the very best. As the Vice President of ParlAmericas, it's always a great honor to spend time with you and looking forward to seeing you soon. So this is the last point I wanted to make. I want to take this opportunity to invite our hemispheric parliamentarians to make plans to attend the 15th Plenary Assembly, which will be held in my country. And this is from September 9th to the 12th, and the Plenary Assembly will take place in beautiful Victoria, British Columbia, on the theme of promoting inclusive societies for sustainable development. And I'm sure that, like me, you believe that this is an important topic and one that will give us opportunities to discuss a lot. And as you may know, Canada has a very large Indigenous population and a very large Indigenous population of women. And so you will get to meet some of the outstanding Indigenous women in our country and the work that they're doing on our behalf and the challenges that they face. So this will be a big part of our work on promoting inclusive societies. Now, before I go, I have a little show for you. So this is all to get your smile going. After the fun we had last night, we hope to duplicate that when you come to Victoria. So we're just going to show you a little video. We don't dance like they do in Trinidad, but we still like to have a lot of fun just the same. We could. I'm going to check to see what how much they charge, and then we'll let you know. Okay, can we run that? Is it available?
Canada is very honored to be hosting the 15th ParlAmericas Annual Plenary Assembly. As Speaker of the Senate of Canada and co-host of this event, it's my great pleasure to invite you to Victoria, British Columbia to participate in these important meetings.
As Speaker of the House of Commons and co-host of the 15th ParlAmericas Annual Plenary Assembly, I too am pleased to welcome delegates from across the hemisphere to scenic Victoria.
For the past 3 years, it's been my honor to serve as Vice President of ParlAmericas and Chair of the Canadian section of ParlAmericas. Our organization has played a crucial role throughout the hemisphere, bringing parliamentarians from all countries and all political stripes together.
ParlAmericas a une réputation bien méritée de forum hémisphérique d'influence. C'est une des sous-organisations qui compte tous les pays des Amériques et des Caraïbes parmi ses membres.
One where legislators come together for respectful discussions on topics that are important to all of us and identify practical options for resolving common concerns.
The theme for ParlAmericas Assembly this year is promoting inclusive societies for sustainable development. Now, more so than ever, we are aware that the strength of our communities is the result of their diversity and that our common prosperity must be balanced with sound environmental stewardship.
I feel very confident that 2018 will be an exciting year for ParlAmericas as we continue our dialogue with parliaments in the Caribbean and the Americas.
L'importance d'échanger des expériences les uns avec les autres à l'échelle internationale et de participer à un dialogue respectueux entre partenaires égaux reste aussi primordial aujourd'hui qu'à l'époque où ParlAmericas a été fondé.
As you engage in discussions during the Assembly, be sure to also leave time for enjoying one of Canada's most beautiful cities, combining breathtaking scenery with a friendly and warm hospitality. We look forward to welcoming you to Canada and to celebrating our vital hemispheric bonds. Thank you very much. I hope that's a little bit of a temptation for you to consider coming to Victoria to visit with us. One last thing I've been promoting, as some of you know, that this will be a great opportunity to bring your spouse or your friend, because we're going to have a program specifically for the spouses this time. So while we're working, they're going to go whale watching, they're going to go all sorts of do certain things. So if you want to have a little fun in Canada with your spouse, this would be a good time to consider it. So lastly, I just want to thank you all very, very much, and to wish everyone a safe journey home, and look forward to seeing you again in the work that ParlAmericas is doing. And again, thank very much Trinidad and Tobago. It was an exciting and great few days for me, and I'm sure it was for you as well. Thank you very much. Merci beaucoup.
Colleagues, Madam Speaker will close us out.
Well, I think after that teaser, there's very little for me to say. But I just really want to say that on behalf of the Parliament of Trinidad and Tobago, it was really a great delight for us to be hosts of this 10th gathering of the Parliamentary Network of Gender Equality, and yes, my Haitian friend, equity. I want to say that I think this gathering was really a great success. And as much as we were happy to play host, I think we had some very wonderful guests from the region. I want to say some thank yous because, you know, in Trinidad we say that behind every good man stands a good woman. And I want to really say that while I may, as a speaker, bask in all the compliments, I do have a very great team behind me. I got us into this, and they bailed me out by doing all the great things. And I really want to start with acknowledging the President of the Senate, who is a great support to me. And if she could stand up, Senator, the Honorable Christine Kangaloo. And for the interpreters, I know we shouldn't say slang, and I hope you could interpret this. In Trinidad, we also say that a deputy is essential. Can that be interpreted? Okay? So, not in context. So I'll try a little more. When we say a deputy is essential, we're really saying that apart from having, say, your spouse, you have somebody else. Okay, I'm not saying that I advocate that, but that's something that we say. But in this context, a deputy is essential, and I have a good deputy speaker. That is Esmond Ford, to whose constituency we went. Tunapuna. And I think Tunapuna is an indigenous word, not so? Yes, Tunapuna is an indigenous word. I also want to say thank you, a special thank you to the head of our team, who would have been in collaboration with ParlAmericas, and who would have overseen everything here. And I mean, she's there, she does everything, she thinks about everything. When we hard, she still smiles and she gets it done. And I must recognize Lynette Joseph Guevara. And Lynette, stand up so everybody can see you. Okay. And Lynette, while I can't call everybody, please extend our gratitude to every member of the team and all the divisions of the Parliament. I also want to thank the interpreters. Okay, and I know that sometimes the task wasn't easy, but I think they delivered so that we, whether we spoke in Spanish, English, or French, we were all able to participate in the conversation, and I thank you all. So I would like to end where I started. And for those who were present at the cocktail reception, you all would recall that I referred to a song which we said, when a stranger comes to our lovely isles, every day you see him or her, they wear a happy smile. And I want to say that I saw many happy smiles from you all. And therefore it means that I don't say adios, I say hasta la vista. And in French, I say au revoir. And to the English-speaking people are saying, see you again, right? No, I can't say slang. It's difficult for the translators. So see you again in Trinidad and Tobago. I hope you enjoy the rest of your stay and safe journey to your respective homes. Thank you very much.
And with that, we close the 10th gathering. Lunch is being served, so you can go and join for lunch again in the Parliamentary restaurant. We have lunch being served. Headsets, please leave your headsets here in the room. And for the members of the executive committee, the new and the existing, can you please stay here with us in this room? We're going to have a quick meeting.
Appreciate it.